Good morning, everyone, and thank you for being here to the media, print media, TV media, radio media. Thank you very, very much. We deeply appreciate your efforts to get our information out. And let me just take this off so you can hear me. The uptick continues. Over the weekend, 84 more confirmed COVID-19 cases. 33 Friday, 13 Saturday, 38 Sunday, for a grand total of confirmed COVID-19 cases of 3,413. Unfortunately, we had one more death. That breaks the string of over a month of not having anyone, he or she, passing away. That brings the total deaths of Springfield residents to 132. And again, my thoughts and prayers and encouragement, sympathy to the affected families for myself and my cabinet heads down the rank and file. The breakdown on that is 57 white, which is about a little over 43%. Black, 31, which is almost 23.5%. Hispanic is 42 now at 31.8%. Asian holds at 2, which is 1.5%. The deaths have occurred, 57 have occurred in long-term care facilities, and now residential is up to 75. I want to thank Governor Baker and DPH, Secretary Sutter, who reached out to my administration, and Commissioner Helen, Carlton Harris, my Chief of Staff Tom Ash, and CAFO TJ Plant were on that call. They reached out to us for any assistance that we might need with this current uptick. Senior citizens meals deliveries continue. I also want to thank Governor Baker for the Stop the Spread. We're continuing to do that, and AMR is here, and the new communications manager, John Karen, is here. John, thank you, representing Patrick Leonardo on that. And they've done well over 5,000 tests. Busiest weekend. Commissioner Helen Carlton Harris will elaborate on that. Over 900 tested this past weekend. Here's the glaring example of why this has to be taken seriously. And again, I was so proud, and continue to be proud, but the residents and business community, that we were a green community, so we know what to do. But Commissioner Helen Carlton Harris will get into this more. This is not a pandemic or virus that is just affecting middle-aged and senior citizens. The numbers are now showing 191 cases on this uptick that we're experiencing now, that 54.5%, 104, are under the age of 30 years old. Under the age of 30 years old. You are not following protocols. 55, or 28.6%, between the ages of 31 and 50, are not following the protocols. Clusters are occurring in homes, and Commissioner Helen Carlton Harris will indicate to you that we're starting to see kids that are picking up COVID-19 being in these homes. With that, we have to stay in phase 3, part 1, until we get back out of this red zone. So that is applicable to any and all. And, you know, even to take this even more seriously, the President and First Lady, which we wish them good health, speedy recovery, encouragement, and Cam Newton, our New England Patriots quarterback, and all others. I don't want to see anybody with this COVID-19 virus. But those individuals have all the proper protocol, all the proper assistance you can imagine, and they still caught it. So that says again to our young people, to everyone, please, we have to and we will knock down this uptick. We're going into flu season now, but you saw the percentages, and Commissioner Helen Carlton Harris will go more into that. This is just not affecting senior citizens and middle-aged people. This is not just affecting nursing homes now or long-term care facilities. We are seeing an increased, strong uptick in our residential areas, and Commissioner Helen Carlton Harris will go more into that. Dr. Robert Roos, the Chief Medical Officer of Mercy Medical Center, is unable to be here. I'll be reading a statement. And Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, is unable to be here, but Dr. Sarah Hessler is here, and we appreciate that. She's going to be doing an update on that. Some brief, quick updates. We had a Zoom meeting with Congressman Neal, Chairman Neal Ritchie, with my cabinet heads. He gave us the update late last week on the federal stimulus and also our needs and what we're looking for. We appreciate that, Congressman, for your continued efforts. The FBI independent data statistics, and I'm very proud of that, as is Commissioner Clapper, came out. And again, these are their statistics. And it shows that the FBI released its annual Uniform Crime Report on Monday. The report shows detailed crime information of cities across the country. In the past 10 years, this is during the Sarno administration, Part 1 crimes have decreased by 44%. City of Springfield violent crime has decreased by 27%. From 2018 to 19, violent crime has decreased by 9%. Overall crime is down 4%. Nationally, crime is down approximately 1% from 2018 to 2019. And some specific stats, I know Commissioner Clapper will speak more about it. 2018, 2019 overall crime, 4% decrease. 2018 to 2019, violent crime, 9% decrease. 2018 to 2019, property crimes decreased by 2%. 2010 to 2019, overall crime is decreased by 27% here in the city of Springfield. 2010 to 2019, violent crime in the city of Springfield has decreased by 44%. 2010 to 2019, property crime in the city of Springfield has decreased by 47%. So to you, Commissioner Clapper, and our brave and dedicated men and women in blue, I appreciate your efforts and the efforts of our residents and our business community very much so. We also, very proud for me, Italian Heritage Month, and Friday in the rain, we raised the Italian flag at City Hall. The Italian Cultural Center of Western Mass representatives and local residents were there, and co-presidents Charlie Becker and Marcia Capuano. We appreciate that. Next week, we will celebrate, there's a Columbus Day holiday, so our press conference and update will not be on Monday, it'll be Tuesday, October 13th. Superintendent Warwick will speak more about it, but we did a tour down at the brilliant, beautiful Brightwood Lincoln School with school committee members and others, and it's just tremendous. Another new school, well over $600 million being built or rehabbed here in the city of Springfield. I was in the Mason Square area late last week, and I noticed that the bricks were still, as Billy Baker told me, the bricks were still wet. They put up the new sign for the Mason Square Apartments, the old Mason Square Fire Station. What a tremendous job that Gordon Pulsifer and First Resource has done with the old Indian Motorcycle Building. My administration worked very, very hard in negotiating that with Governor Baker and his administration. A much talked about project for many, many years, 20, 30 years, has come to fruition with workforce housing, and I'm very happy about that. Quick update on the police with Commissioner Clapper. She's down 2 in COVID, 1 officer, 1 civilian. We were ready to start another academy of recruits, 34, and in the abundance of caution, we've had to delay that class for a week. There was about 7 recruits that were running temperatures. and they're going to be AMR. We appreciate. We're testing immediately, and quarantines will go into place, and we'll reassess for next week. That was the right thing to do. Commissioner Clapperud, until we do get back into our schools when they're safe and sound with our buildings for our students, teachers, and administrators, the Quebec officers are on the streets. So that's very, very helpful, and we appreciate that. They've been transferred to on the streets. Bob Kirshner continues with Pat Sullivan, Helen Carlton Harris, Superintendent Warwick, on reviewing of our school buildings, and that will continue. Commissioner Calvi from Fire indicates to me that nobody's down in COVID. That's fantastic. And I want to commend all my cabinet heads, too, department heads and rank and file. You know, you've seen other cities and towns become decimated with loss of workforce. We've been pretty good from the early days where we took a hit on protecting our workforce. They had a quiet weekend on fire, which is very good to hear. Superintendent Warwick indicates to me we have now served 3,306,042 meals to our students and families since the start of this pandemic. That is breakfast, lunch, dinner, and snacks. 95,816 went out this weekend. We continue, Pat Sullivan, Helen, Superintendent Warwick, the reviews of our school buildings, industrial hygienist Bob Kirshner. The attendance rate, because we're running a full school now, structured, grading, and attendance. Superintendent indicates to me 92% attendance rate on our remote learning. Preschool started last week. iPads are going out. The helpline is in service. Pat Sullivan, my director of facilities and parks, indicates, again, they continue to review all the buildings with industrial hygienist Bob Kirshner. They're starting to look at winter protocols. Pat will speak more of that on how we utilize our buildings and how people can enter our buildings. Pat, and again, I can't thank the MSBA enough, and I can't thank our city side too. $4.5 million in school repairs have been completed over the summer. 1.5 of that working with Eversource on electrical improvements, electricity improvements. So that's outstanding. DPW, Chris Signoli, I saw you guys early this morning getting rid of the recyclables out in the back of City Hall, and gave them a fist bump. Thank you, appreciate that. Nobody down in COVID, which is good. We seem to be jinxed. As soon as we repair traffic controls, accidents take them down again. So a couple of major intersections, I know at St. Michael's Cemetery, I was there for a funeral this weekend, is down once again after it's been fixed. So DPW is working on that, and we have temporary measures for vehicular and pedestrian traffic and police if needed. Finances, my CAFO TJ plan indicates to me, and first of all I want to congratulate TJ and our finance division. This is the 13th year in a row finance and administration have received the independent government budget finance award. 13 years in a row, so congratulations on that. Lost revenue for FY21, we've lost $887,000. Since this pandemic has started, we're down 8.5 in deficit. $5 million deficit currently now because we continue to write off on grants, FEMA, and reimbursement. Again, I will continue to go after every dime I get my hands on for the residents and the business community of Springfield, as we have done with past natural and man-made disasters. One interesting thing on a side note that TJ indicated to me, which is not good, we're down about 23% on our meal taxes, about $129,000. But if you project that out throughout the whole year, you're talking about a $62.5 million hit pertaining to our restaurants on sales going in. So we're going to try to continue to work with our restaurants. Economic Development, Chief Development Officer Tim Sheehan indicates to me that we are also, as we thought, but it's coming at a quicker pace, seeing an uptick. We put $2 million aside to help our residents with rents, utilities, and mortgages. They already have gone through 25% of that $2 million with Wayfinders being my conduit or liaison, so we're keeping a track of that. HUD has okayed that $1.7 million for continued business assistance and workforce development, and the business assistance will continue. On the HR labor front, Ed Pakula gave his status quo update. Bill Mahoney indicates to me that the unemployment rate, I don't have it for Springfield yet or Massachusetts, but the unemployment rate for the United States of America has moved down from 8.4 to 7.9. He does indicate to me, and Helen will go into this, that 6 more states have fell off the okay list. 6 more states, and Helen will go into that. With that, let me read a brief statement from Dr. Roos, who sends his regrets, and then I'm going to bring up Dr. Sarah Hessler from Bay State to give the Bay State update. And we continue to work very closely with our hospitals in case something gets out of control, and the hospitals will be able to handle that spike. We are now seeing from the old days where the hospitals were getting a spike because it was older people contracting this COVID-19 coronavirus. It's much, much younger people. They are not going to the hospitals. So that causes an issue there. So from Dr. Roos, his statement, in a week where coronavirus pandemic has reached into the White House, affecting the President and First Lady and a growing number of dignitaries, and cases continue to rise across the country, we at Mercy Medical Center first and foremost wish everyone good health and urge you to stay safe. Mercy Medical Center continues to have low numbers hospitalized patients, and as with this morning, we only have two COVID patients hospitalized, neither of which are in intensive care. This is largely the result of continued success in keeping infection rates relatively low and utilizing treatments and early prevention strategies appropriately. However, we do recognize that new confirmed cases of coronavirus have increased in the Commonwealth, as has the total of number hospitalized patients. We at Mercy Medical Center have, in fact, seen our weekly test positivity rate increase to 2%. Again, if you remember correctly, Bay State and Mercy in the state were hovering at 0.8. It's 2% now, for the first time in over 2 months. There are cities and towns in all regions, including our own, that continue to see clusters of new infections related to gatherings and lack of adherence to public health and safety recommendations. To all you young people out there, you are not invincible, and then you become spreaders. All the evidence reinforces that the virus is very much still present in our own community and across the country. I ad-libbed a little bit there, by the way. This is a statement. The virus, you didn't think, Doctor, that he wrote that, huh? Okay. The virus can spread very easily, particularly in settings where people gather without masks and or keep the appropriate physical distance, even when people are tested regularly. So, this week, and as always, please continue to take the appropriate precautions to keep yourself and others well. We at Mercy Medical Center will continue to be here for you, and we will always make priority your safety and the health and well-being of our community. Let us remain vigilant, stay safe, and follow the science together. Thank you all for what you do. Dr. Robert Roos, Chief Medical Officer, Mercy Medical Center. And with that, I am now going to bring up representing Bay State Health Systems and Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, Dr. Sarah Hessler, and she will give the update pertaining to Bay State Health Systems and Bay State Medical Center. Thank you very much.
Great. I'm also going to remove my mask here so everyone can hear me now that people are 6 feet away from me. Great. Hi. Thank you. Thank you, Mayor, for inviting us and continuing to allow us to participate in educating the community and giving updates from Bay State's perspective. So I actually do plan to address what's been going on nationally, but first I just wanted to start with what's happening and what we're seeing at Bay State. Bay State Labs has tested 69,000 patients and community members that are, in the Bay State system. And then we've also done an additional 40,000 tests through outreach, which are at other facilities that are non-Bay State facilities. Of the patients that we've tested, 2,500 of them have been positive since the pandemic started in March. Since that surge began, we have treated 1,178 patients at Bay State hospitals with COVID. Not all of them were tested positive at Bay State. Some had been tested at other facilities in nursing homes, et cetera, and then transferred into Bay State. Of the patients that we've treated in the Bay State system, approximately 250 have died. And that number has been stable like that for many months now, because we have seen, as the mayor expressed, a real change in the epidemiology of the pandemic, away from the epicenters in nursing homes and among the elderly, and into younger patients who don't have as high a mortality rate. Since Dr. Kerouac last gave you an update, we've continued to have on average about 10 to 15 patients hospitalized at Bay State on any given day. Currently, we have one patient in an intensive care unit. And as the mayor alluded to, that number for us has been stable and really hasn't changed, even though the state is seeing an uptick in the rolling average rate of positivity. It seems to have not increased the number of hospitalized patients that we have at Bay State. When we look at our patients that are testing positive in our system and trying to understand who are they and what is the risk for us to see another major surge, we are again seeing the same pattern, where it's not predominantly elderly people anymore. It's mostly young and middle-aged people who are testing positive. And a lot of what we're seeing are family clusters. And that makes sense if you think about the way that life has changed since the pandemic started, where we spend a lot of time being careful around others that we don't know, but when we go home, a lot of us take our masks off and we don't necessarily practice social distancing. So when a family member does contract COVID, it does leave a lot of the family members susceptible to contracting the disease, and that's exactly what we're seeing in our data. The state's rolling average right now is 1.1% positivity. That sounds low, but when you take into consideration that a tremendous amount of testing is happening among asymptomatic people that are about to undergo a procedure, so it's what we call, pre-procedural testing, those numbers have been very low because this is a safety testing, and so those numbers tend to wash out the numbers that we had early in the pandemic, where we were really only testing people that were symptomatic, and so that's when we were seeing more like a 25% positivity rate. So at Bay State, our rolling average currently is also 1.1%, in line with what's happening in the rest of the state. A couple other things about Bay State. Our testing centers for outpatients are now, as we are facing cold weather, we're starting to set up processes to try to bring those into warmer conditions and protected areas, so that our healthcare workers aren't standing out in the snow and the cold trying to await the people that need to be tested. Our employees at Bay State continue to practice universal masking. That's been in place for many months now. In addition, we ask our healthcare workers to wear eye protection, so either goggles or a face shield when they're within 6 feet of patients. And any healthcare workers that are taking care of patients that actually have COVID or are a person under investigation, a PUI, are wearing an N95 mask. Currently, our supplies of personal protective equipment are adequate to protect us and enable us to safely care for patients if we were to see another surge. Now I just wanted to briefly address what's been going on with President Trump, because I know that a lot of people are concerned about this, and again, we all wish the president, his family, and his co-workers, speedy recovery. He has required hospitalization. He's at Walter Reed Medical Center, and he's required oxygen, supplementary oxygen. We're not aware of how much, how long, or through what mode he is requiring oxygen. He's also been treated with multiple drugs, some of which are investigational. So these include the antiviral drug remdesivir. In addition, he's received a very powerful steroid called dexamethasone, and he's been given an experimental therapy. It's called REGN-CoV-2, REGN-CoV-2. Now, this is an investigational monoclonal antibody therapy that's not available on the market, and that was given to him through a compassionate request through the FDA. And just to remind everybody about antibodies, so this is a monoclonal antibody drug. Antibodies are proteins that the immune system, the white blood cells in the immune system, make in order to protect us from invading pathogens, so bacteria, viruses, and others. And these proteins attack and neutralize invading pathogens. And so the idea here is similar to, with the monoclonal antibody therapies, are similar to the concept of giving patients convalescent plasma from patients who have received, been infected with COVID-19, have recovered, and then their blood is retrieved and the antibodies are taken out and then given to patients. He did not receive convalescent plasma as far as we know, but the experimental therapy that he received is similar to that. It's just a lab-produced antibody specific against SARS-CoV-2. So at Bay State, we also provide all of the treatments that the president received, except for this REGN-CoV-2. This is not available on the market, and it's still in clinical trials. And I would mention that this is not FDA approved, and the clinical trials are not completed with it. And they have not been peer reviewed in the medical literature, and we really don't know much about this drug because it has not made it into the medical literature yet. So we have an ample supply of dexamethasone, oxygen, obviously, and remdesivir at Bay State in case we do see another surge and need to treat patients with those drugs. When patients with COVID-19 come in, we follow protocols about who should receive dexamethasone, oxygen supplementation, and remdesivir. The president's sickness really underscores a number of factors that I just want to remind people of and point out. And I think the mayor has really already started this conversation for the community. But I want to remind everyone that the control of this pandemic is really a multi-pronged approach. And so those prongs include social distancing. We're all sitting 6 feet apart in this room. Mask wearing, we're all wearing masks. Hand hygiene, right? So washing your hands with soap and water or using alcohol hand rub. Testing to know who's positive so that we can isolate them and trace their contacts. Contact tracing is very important, again, because we want to isolate people so that the virus doesn't spread. So unfortunately, the main strategy at the White House appears to have been testing without social distancing and mask wearing, which is seen in many photos of events and other things. And so I think that it should prompt us to step back for a minute and just think about the fact that we can't only practice one part of this control strategy. We need to practice all parts of the control strategy in order to keep ourselves and our families and our communities safe. The last thing that I wanted to just mention today is that I really want to raise awareness about influenza season. We're very concerned about influenza at Bay State because I think that we're at a real risk to face a twin epidemic this fall. So as everyone's aware, there is an influenza epidemic that happens every year in the United States. Every year, it's going to happen like clockwork. It starts sometime between now and usually December, sometimes not as late as January, and then it ends sometime around March or April. It happens every year. We have a huge spike of cases. We have usually around 80,000 deaths or more in the United States, and many, many millions of people that require hospitalization. So the strategies to prevent the spread of influenza, many of them are the same things that we're already doing to protect ourselves against COVID-19. So those include social distancing, mask wearing, hand hygiene, right? So we already know how to prevent a big epidemic, but there's one other tool that we actually do have in our toolbox for influenza that we don't have for COVID-19 yet, and that's the influenza vaccination. So that has become widely available now. It's time to get your flu shot. It's the best protection that we have, even if you feel like you're young and healthy and you don't need to get it. The whole idea here, I think, as we've learned from the COVID-19 pandemic, is that protecting ourselves is also protecting our community and our families. So even if you feel like you don't necessarily need one for yourself, you definitely need it in order to protect the community. The more that everybody gets a flu vaccine, the lower the risk in the community and the more protection we can offer to our family members and those that are vulnerable within our communities. So with that, I'm happy to take any questions if you feel I have time.
Now take any questions that the media might have.
Yeah.
One of the things that has become very apparent in the course of what's been going on with the president is this question of testing relative to exposure.
Yeah.
It did not seem nearly clear enough until this happened that we were testing negative, even several days later. It is the same thing as actually being in the clear, because the impression was that if you're pre-symptomatic or asymptomatic, but you're shedding the virus, you must therefore have enough going out there that you could possibly test positive on a test. So I don't know if you want to speak a little bit about how these timelines really work, because that's been really confusing over the last week.
Sure, and that's a great question. So just to repeat the question for the purpose of the microphones, the question was around testing, and is testing really a substitute? And if you're testing very frequently, how is it that people could still have gotten infected and passed it within the White House? And so I'm glad you asked that question. Thank you. So I want to step back for a minute and just talk about some of the science, some of what we know about how the virus is spread from people to from person to person. So so we have a time to first symptoms onset. So the time after someone is exposed until the time that they first develop symptoms, on average, is 4 to 5 days. And the time that they are able to transmit the infection starts 2 days before their symptom onset. And so even though someone may be asymptomatic, not showing any symptoms, they could certainly be passing it because they're in what we call the pre-symptomatic phase, right? And so anytime we do outbreak investigations, we go backwards 2 days prior to the first onset of symptoms in terms of deciding who is at risk in that room. So, some of the other specifics about testing are that testing isn't 100% perfect. So there's a lot of what we call operator dependence with this. And the reason I say that is because the person that's collecting the swab has to do the swabbing correctly in order to get the virus from the nose, or sometimes it's done, there's some saliva tests and some other mechanisms. Sometimes they go very far down in the nose. That's called a nasopharyngeal swab. Some swabs you can do in the front of the nose. Some places use saliva tests. And which one of those are selected depends on the platform that the test is run on. And that gets to the test characteristics and the specifics of the platform that this PCR is on, the actual machine. Okay, and so the PCR, these are PCR-based tests. They're extremely sensitive, and you're correct. They pick up tiny amounts of virus and amplify it so that the machine can detect that it's there. But if the swab wasn't collected well in the first place, even if the person is infected, there may not be any virus on the swab if it wasn't collected correctly, and that would result in a false negative. Similarly, not everybody is shedding enough virus at the time that the test was taken for it to be detected. That's very uncommon, but it can happen. And then this is a rolling. It's rolling as people become infected. They may not test positive on this day, but a day or two later, that's when they may test positive. But if they're in that pre-symptomatic phase, they may have already exposed people. So that's why I'm saying that while it's important to have testing, it's a very, very important part of the infection control strategy for this country and for the globe. It's not the only thing that we can use in our toolbox in order to prevent the spread and to prevent outbreaks from happening. We also need to use masks and social distancing as well as hand hygiene.
Is there any other questions? I know Nick Arresto is here from 22 Western Mass News, Paul Tuthill. Any other questions?
Well, if nobody else does.
Go ahead.
So a related question to that is also the question of like if you are, what is exposure, I suppose, in terms of the situation. This is weird, this is playing out in such a public way.
Yeah.
Especially right after we had a presidential debate last
Sure.
week. Because like Vice President Joe Biden is now saying to release the results of every test he has, and he's still campaigning. I mean, is there necessarily like a hard fast rule that if you're what your level of exposure is, whether you're actually in quarantine or whether having some level of testing might be enough if you're doing it every day in lieu of quarantining? I don't know if you speak to that a little bit.
I'm looking right at our Commissioner of Public Health. So I actually will defer to the Commissioner on this because this is really public health. There are definitions of what constitutes an exposure that the CDC and the state's Departments of Public Health are following in terms of who is considered to be exposed. And it has to do with proximity to a person and whether people were masked and the duration of time in proximity to a person with the infection. So those are clearly defined already, yeah.
Thank you, Dr. Hessler. Great job.
Very good, thank you.
And we'll let you go back to your important duties.
Thank you very much.
Very, very much. Very informative and knowledgeable. Thank you, Dr. Hessler. I call her my Dr. Anthony Fauci, and that is the Commissioner of Health and Human Services, Helen Carlton Harris. Please heed her advice. You're going to be hearing it now, and I think you'll be hearing it on calls we'll be making to your household too. Please, when her team calls you for contact tracing, the information is important not only to you, but for our community. Without further ado, the Commissioner of Health and Human Services, Helen Carlton Harris.
Thank you, Mayor, and again for your leadership. Very appreciative.
Thank you.
First of all, let me start by saying today is Breast Cancer Awareness Day. We celebrate breast cancer awareness throughout the month of October, but this day is designated as the Awareness Day. So I want to start by saying to all of the individuals who are breast cancer survivors, we are thinking of you throughout the month, and thank you for who you are and the strength that you've shown. Also, it is our time to make sure those of us who need to have mammograms are doing that. It is my understanding that mammograms have been put off because of COVID. Women are not having them as frequently as we should because we have been particularly staying away from hospitals. I would ask that the hospitals are safe. Bay State and Mercy have both told us that they are receiving patients. So please have your mammogram and make sure that you are contributing to Rays of Hope as well. And any other venue that you choose to support breast cancer awareness. This has been a week where we have seen 166 cases of COVID-19 positive. You will remember last week it was 124. And so we are seeing the cases in the city of Springfield increase. The mayor spoke about 104 cases. I analyzed 201 cases, and I analyzed 206 cases and looked at 191 of them because some of the cases did not have complete data. And so an analysis of 191 cases, the mayor said and told you 104 or 54.5 are under the age of 30. 55 or 28.6 are between the ages of 31 and 50. And then 32 or 16.7% are over the age of 51. Of that 32, 17 or 8.9% are 60 and over. 15 or 7.8% are between the ages of 51 and 59. So I want to back up to that 17 or 8.9% that are over the age of 60. That tells us that individuals over the age of 60 are taking the necessary precautions. You are taking this virus seriously. Individuals under the age of 50, particularly under the age of 30, have become the highest risk group for COVID-19 in the city of Springfield. As was mentioned, that is a shift. Early in the pandemic, we were talking about individuals over the age of 55, 60 being the numbers that we were seeing the most of and the numbers that were being hospitalized. What we know is that the younger individuals are not being hospitalized obviously at the same rate as an older individual based on underlying conditions. So what it is important to acknowledge, while the hospital numbers may not be increasing, our numbers of positivity is increasing, and those numbers are younger individuals. I'm going to move away and start with these charts. And so this is the COVID-19 cases for the city of Springfield last week. As you can see, we had spikes on the 30th, October 1st, October 2nd, and October 4th, which was yesterday. These are the number of cases, 166 cases this bar represents. And so we know what our number is, 166. The next chart I'm going to show you is the zip codes related to those numbers. I want to be clear, my showing the zip codes has nothing to do with trying to stigmatize any neighborhood, any zip code, any individual. It really is to show us what this city looks like as far as our positivity rate is concerned and where we are seeing the most prevalence. And so these are the zip codes that we are, that I am reporting on. 01103, again, this is during our last week, 9/28 to October 4th. 01103, 6 cases. 01104, 22. 01105, 24. 0107, 10. Now, what's important about 0107 is that when I told you last week, they were one of the zip codes that we were very concerned about as far as the prevalence and the numbers were concerned. It appears that they are doing a good job of maintaining a lower positivity rate in that zip code. 01108, 39. 01109, 41. 011181, 011198, 011285, 011293, 011516. And so what I'm telling you at this point is where the hot spots are in the city of Springfield. If you look at these numbers, it's very easy to discern where those hot spots are. Again, this is not to call out any zip code, but to say that these are the numbers that we are seeing. Now remember what I'm saying is that the numbers, the 166, the numbers that we talked about, are in younger individuals. These are the zip codes where we're seeing those numbers. I certainly have streets, and obviously based on privacy and confidentiality, we will not be releasing streets, but we do have that and we are reaching out and will continue to reach out. We did meet with the State Department of Public Health, as the mayor said, and they have offered some resources, some of which we will take advantage of as a city, so we will be talking to them. Under the mayor's guidance, we will be doing a robocall today to all of the residents. We will also schedule a neighborhood council and civic association Zoom meeting with every neighborhood council and association in the city to continue to have this conversation. We believe very strongly that this virus, this pandemic, is something that we can once again get our arms around, but we need the cooperation. So I'm going to ask, and I should also say that when I looked at the data, there are children on our list. The youngest child that I saw on our list was 2 years old. So this is a virus that is in young individuals and in younger children as well, as far as the data that I have for the city of Springfield. So no one is immune as far as this virus is concerned, and we also know that children can be super spreaders because the virus is in their nose and obviously in their mouth, and so we know that children are spreaders. We're also seeing clusters in homes. So the doctor talked about we are indoors more, we are clustered more, we may become, kind of complacent because we think we're around our family members and we don't have to take precautions. But we need to really be reminded, anyone new that comes into our environment should be, absolutely, we should be wearing face covers, hand hygiene, and social distancing. Travel, I must say that I'm not sure about anyone else, but I'm seeing a lot of license plates from other places. And so the travel orders, there are only 6 states that are on our travel orders right now, so that are exempt. New York, Connecticut, New Hampshire, Maine, Vermont, and Washington, D.C. If you have relatives and individuals coming from any place else, they must quarantine for 14 days, have a negative test, and they must fill out the travel form. We are not doing this. The governor is not doing this because he wants to restrict us from visiting with each other. The states have high COVID rates that are going up. And so we want to make sure we are protecting you and your families. There are clusters. Our outreach will be concrete. The contact tracing. If you get the contact tracer that calls either from the city of Springfield or the Commonwealth of Massachusetts, please make sure that you are responding and giving all of the information. The only way we can stop this spread is if we understand who has this virus. Stop the spread. The testing will be going on until October the 31st. To date, almost 10,000 Springfield residents have been tested. AMR has done 5,452 of those tests. And overall, AMR has tested 9,124. We are very appreciative of the work of AMR, so thank you very much. AFC Urgent Care is still doing testing at their Cooley Street facilities, Monday through Friday, 11 to 7, 10 to 4, Saturday and Sunday. Fallon will be setting up a site at another location, which I expect we will be able to announce that today or tomorrow. We continue to work on making sure it's in a public place that is accessible. The institutions of higher learning, our colleges, we continue to receive information from our colleges. It appears that most of the cases that we are seeing in our uptick are residential cases in the city of Springfield. They are not cases that are coming from our institutions of higher learning. Now, I don't want to say that they do not have any cases, because they do. But the majority of the cases that we are seeing, witnessing, are not from the colleges and are not from MGM at this point. Again, MGM and all of the colleges in our area have had minimal cases, but they are working, and we are working to make sure that that does not become a cluster. So they are taking the steps out of an abundance of caution, and I'm appreciative of the partnership that we have. Our behaviors. It's important that I ask you parents, now that we know that a good majority of these individuals who have positive cases are under the age of 30, under the age also of 21, if there are young people in your environment, your children, young people that you see, and you see that they are not wearing face coverings or doing hand hygiene or social distancing, please encourage them to do that. We all have to step up, and parents have a role. Neighbors, if you see young children or any individual that is not wearing a face cover, social distancing, or hand hygiene, please encourage them to do so. Businesses, I ask you to continue to be vigilant about not letting individuals into your stores who do not have their face covered, because this city cannot move forward to step 2 of phase 3 until we get this virus under control. So this impacts our economic health as well. So unless and until we get this under control, we will stay stuck where we are and potentially have to move backwards, and that is not something that we want to do as a city. So I implore you, COVID-19 is a highly contagious, transmittable virus that kills. This is not something that we want to impose on anyone in our city or in our state or in our country. So please take our advice very, very seriously and use the tools or the non-pharmaceutical interventions. Wash your hands 20 seconds or more. Social distance minimum 6 feet. If you can do it 9 feet, that's fine. Also, make sure that you are wearing a face covering. That is something that we can also easily do. Put on a face covering, protect yourself, and have others protect you, and you protect others. This has been a long haul. We are all feeling COVID-19 fatigue. People are tired. And I get that. I really understand that people are tired. Our emotional health has been strained like it never has. Our physical health is impacted. But unless and until each of us takes this virus seriously, we will not be able to move forward. Again, we are, as a city, taking this seriously. I am very appreciative of Jason Mann, who works for Economic Development, who is kind enough to do these bar graphs and maps for me. So I thank him. I also want to end with flu season. Flu season is upon us. If you can get your flu shot, do that. I'd like you to do it by the end of October. It takes 2 weeks. So when you get a flu shot, it's not effective immediately. It takes potentially 2 weeks for the antibodies to build up so that you are covered as far as immunity is concerned. So I'm asking you, please go and get your flu shot, particularly individuals with chronic conditions, individuals with underlying conditions, asthma, diabetes, cardiovascular disease, get your flu shot. We're asking individuals 6 months and older, get your flu shot. The city will be doing flu shots. We are in the process of putting our schedule together. I will be able to announce the schedule next week of the flu shots that we are doing. I know that we will be this week, I believe, at the Raymond Jordan Senior Center. And so we will get that information to you. Again, thank you for the cooperation that you have given all of us at the Department of Public Health, and let me thank my staff who does a tremendous job as well. We will, as the mayor continues to tell us, he's our cheerleader, he continues to tell us that we'll get through it, even though there are days when we look at those numbers, we think this is going in the wrong direction. We can right this ship. We can do it by doing the things that we know we need to do. Wash your hands, and you hear it all the time, and I know you might be tone deaf to it. Wash your hands 20 seconds or more. Cover your face with a face covering, socially distance at least 6 feet, and make sure if you have relatives who are coming, and I know that Columbus Day is coming, Thanksgiving is coming, if you have relatives who are coming from other places other than the 6 that I mentioned, please make sure that you are vigilant, careful, and make sure that they quarantine for 14 days or have a negative test. I thank you, residents, for everything you have done and everything you will do and everything you continue to do. Thank you, Mayor.
Thank you, Helen. Thank you, Commissioner Carlton Harris. I want to also thank the sign language young ladies that are here. I really appreciate that. And please heed Helen's advice. I believe with New York City, they're taking a step or two backwards now and ordering shutdowns and schools being closed. We do not want to go there. So I need you to continue to partner with us, especially the young people. You are not invincible. Don't find out the hard way. And speaking of young people, I'm now going to bring up the Superintendent of Schools, Dan Warwick, and he will give an update pertaining to our school system. Superintendent of Springfield Public Schools, Dan Warwick.
Thank you, Mayor. Morning, everyone.
Morning.
As of this weekend, as the mayor said earlier, we've provided 3,306,042 meals to families across the city since we closed down in March. Just this weekend alone, 95,816 meals. Again, we have 18 sites open Monday, Wednesday, and Friday from 2 to 6. We had good news on our attendance. We looked at our attendance for the month of September, and we averaged over 92% average daily attendance. So things are going in the right direction. I credit the teams at every school for their outreach to families for that success. The extra 10 days we had for planning up front, as part of that planning, We had all of our teachers and counselors reach out to every family to get them involved in the process, and that has worked very well. Our preschool started last week. We're off to a good start with preschool. And due to the mayor's support and a grant we received, we've been able to buy iPads for all the preschoolers, and we're going to be arranging a distribution of those iPads within the next week. We'll be in touch with those families. We started a helpline for families to reach out to when they have an issue with technology, and that is working very well and getting a tremendous response. Last week we announced it, but we have a $1.2 million grant that we received from DESE. Again, we used it to purchase iPads, laptops, and we're providing Comcast Essentials for many of our families. So the connectivity issues, we're resolving those as well. Again, we have a full learning schedule all day, and it's going very well. This last week, we had the opportunity to go through the Brightwood and Lincoln project with the mayor, and that project is going along very well. And as the mayor said earlier, over $600 million worth of building projects with the MSBA. So that's the most in any city in the Commonwealth of Massachusetts. Way more than Boston, and when have you seen Springfield actually get more state funding than Boston? Never in my mind has that happened in the past. Not only are we doing the new building projects, we also have the Berry and Homer moving forward, but again, accelerated repair projects in over 30 of our schools, and our average building is 55 years old, so this was a much needed piece to improve the buildings, and again, I thank the mayor for all of his support with that. I was reading an article and just went through it. 10% of the cases across the country are children. So as Helen said earlier, this is not something that only affects the elderly. The children are subject to this disease, and I think it validates some of the precautions we've taken as a city with our children. As the mayor said earlier, Bob Kirchner's going through the buildings with Pat Sullivan. He and Helen have been a tremendous support to us. We're going to take a look at our ventilation systems, but again, to just allay any fears, we do not have an air quality program. We're checking ventilation to meet ASHRAE standards out of an abundance of caution for our students and staff. Thank you.
Thank you, Superintendent Warwick. Thank you, Superintendent Warwick and your team. And again, as Superintendent Warwick, Dan reiterated, there is not an air quality issue in our schools. This is going more stringent on the COVID-19 movement of air and ventilation of air. With that, we'll now go to the public safety component of this update, and I will bring up the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. As the mayor reported at the fire department this week, we have no one out with COVID or COVID-related illnesses, so we're in good shape there. We continue to make sure mask wearing on calls, hand washing, station sanitation with the help of Pat Sullivan and his crews from the custodial team, keeping us all safe at the fire stations. It was a quiet week last week for fires in the city, so thanks to everybody out there for that. Had a couple accidents, a couple small kitchen fires that didn't get to working fire status, so everybody's doing a great job out there. Keep up the good work and have a great week. Thank you.
Thank you, Commissioner. Thank you, Commissioner Calvi. Now for the police perspective, the Police Commissioner for the City of Springfield, Cheryl Clapprood.
Thank you, Mayor. Good morning, everyone. As reported, I am down 2 because of COVID, 1 officer and 1 civilian. The civilian worker worked out of 130 Pearl Street, so out of an abundance of caution and thank you to AMR, we had 50 of us tested Friday that work inside 130 Pearl Street. So far, everybody back is negative, and I'm thankful to that, and thank AMR. As the mayor mentioned, we were supposed to begin a recruit academy today at 50 East Street. Springfield Police have 34 recruits in this academy. They're desperately needed. I've had 32 retirements this year, so the numbers always are a delicate balance for me. 4 recruits from West Springfield and 2 from Springfield College. When they arrived at 50 East Street this morning, as protocol, their temperatures are taken before they get out of the cars. During this routine temperature taking, it was noticed that at least 7 of the recruits had a higher than what is allowed temperature to enter the building. Thank you again to AMR. All the recruits' temperatures are taken, and a decision was made to postpone the beginning of this academy for at least 1 week. I would like to get the results of those tests. I would like to have them retested before they start on Monday, and we'll try it again, set it up for next Monday. I know there's other issues out there, a stomach bug going around, so hopefully it's not a COVID issue. If it's a COVID issue, hopefully we minimized it and we can get going. I need the class to start as soon as I can. I would also like to thank Pat Sullivan. He's taking care of 50 East Street to make sure that's a safe facility for this class to start. And he also helped tremendously with 130 Pearl Street to making the employees feel much safer when they went back to work after a positive test. I am happy about the FBI statistics. As the mayor mentioned, it showed a drop in all the categories. I know we have our hands full with this year coming up to 2019 to 2020. Most major cities are seeing quite the increase already. Hopefully we have been able to keep a lid on this, the violent crime, the property crime. We are aware of it. I attribute a lot of our success last year to the relationships we have with the community. And our ordinance officers and our C3 officers are constantly meeting with the community. Pre-COVID, we go to as many as we can. And I think it's a result of taking care of the community's issues. They have more ordinance and quality of life issues than some of the major issues. But by taking care of their problems, I think we build up a trust so that we're notified of the larger issues. So I hope that can continue somewhere, somehow during this 2020, although I'm ready for anything, as we all are, I'm sure. The weekend wasn't bad for us. There was nothing of major significance. They did make a couple of major arrests. Again, a shotgun was seized in one of the arrests, a lot of drugs. So we continue on that front, as we always do. And I thank the women and men of the Springfield Police Department for their diligence during this time. They've seen the COVID numbers rise high, and we've taken care of it. We were down to 0 for several weeks, and now we're seeing a little spike. But they have never stopped. Their work ethic has never stopped, and I appreciate that greatly. Thank you. Thank you, Mayor.
Thank you, Commissioner. And by the way, the stats I received on this current year, and we are in such surreal and challenging times, we're hovering 4 to 5% crime being down also. So I commend the police department on their very, very difficult times. And again, as Commissioner indicated about weapons and guns and drugs, again, I plead to the court system, especially some judges, these repeat criminal violent offenders. You have to keep them off our streets and out of our neighborhoods. That's what the citizens across all walks of life, across all neighborhoods want, and that's what I want also on that. Speaking of being out there day after day, our unsung heroes, that's been the Department of Public Works, the men and women there, picking up your trash, picking up your bulk, picking up your yard waste, picking up your recycling. I've heard from many, many people about we have a tremendous amount of construction going on, road construction going on throughout the city, and we're happy about that because that means progress and continued infrastructure improvements. And that's under the leadership of Department of Public Works Director Chris Signoli.
Thank you very much, Mayor. With regard to DPW, we are at full staff. We have no employees out. As the mayor mentioned before, over the past 7 to 10 days, we have had 3 major accidents which have completely destroyed traffic controllers in the city. Walmart and Boston Road, State Street, and Berkshire Avenue, and Pine and Central. These are accidents where the controllers are completely damaged, so they have to be rebuilt from scratch. Those usually take anywhere from a week to 10 days to do when we're doing one, but when we're doing three, it's going to take a little bit longer. There has been an increase in traffic accidents and throughout the city that I know we've had to work with the police department on. With regard to DPW, as I mentioned last week, we have about 14 openings in the department, so if people are interested, we're looking for basically every type of individual in our department, so we would like to have people very much apply for those. Those are all on the city's websites, and we are getting ready to enter into the winter season. For those people who are interested in plowing for the city, our advertisement is out. And we increased our fees associated with plows, especially the bigger ones in the city. And as the mayor mentioned, we also have a significant amount of construction going on, which will start to wind down over the next few weeks. And the other item, we had a meeting in the mayor's office last week with Eversource and Columbia Gas to discuss with them the turnover from Columbia Gas to Eversource, which will be happening over the next month, and how that's going to be impacting the city and our residents. And we look forward to that turnover, and as far as getting a lot of their work done as well. With that, that is it from the DPW. Thank you.
Thank you. Thank you, Director Signoli, and again, thank you we did meet with Eversource as they transition to take over Columbia Gas, because we want to make sure that the residents and the business community get the service that they deserve. And that was a key meeting, and we've had good working relationships, and we want to continue that for our residents and our business community. Now, I call Helen, my Dr. Anthony Fauci, I call this next gentleman the Wizard of Oz. That's the Director of Parks and Facilities, Pat Sullivan, who always finds a way to get things done in multiple facets and working with all cabinet heads here. So without further ado, the Director of Parks and Facilities Management, Pat Sullivan.
Thank you, Mayor, for your continued support. I'd like to thank the residents for continuing to follow our protocols as you enter City Hall and Tapley Street. And as you see the numbers that Helen presented, it was the right decision to continue the protocols, and we've decided to go through the winter season to continue with those appointments. We know it's probably an added step. It's causes maybe some difficulty for you, but it's very important that we follow these protocols, and it's really common sense at this point. We've seen what's happened across the country with the president. When you don't safe social distance, you don't wear a mask, you're going to catch this disease, and we don't want that to happen to anyone. We're continuing to follow best practices for our buildings. We're going to be meeting with finance on Wednesday to try to match up some additional materials to grants that might be available, so we'll have more updates on that next week. We've completed $4.5 million in school repairs, and as the mayor indicated, about over $1 million was with our partnership with Eversource and lighting. So even though everyone's not in the buildings, we continue to maintain our building stock, and we will be ready when that decision is to move forward. We hope in about 2 weeks that information will be made known. Park projects, we will be starting Ruth Elizabeth, Emily Bill. I got to congratulate Chris on that Central Street project. It's a new day for Ruth Elizabeth. When you see the road being cut in, it'll have new sidewalks approaching that park, and it's going to be really a beautiful project when the road and the park are completed. And I want to also thank Tim Sheehan and the mayor. They provided the funds to match the Nancy Lieberman Court Foundation. So in about a week or two, we'll be starting a new court at Calhoun Park. So Mayor, thank you.
Thanks, Pat. Thank you, Director Sullivan. As I always say before I bring up this gentleman, Springfield's in the business of doing business, and I appreciate all the efforts being put forth by Chief Development Officer Tim Sheehan and his team as we continue to work through triage of our businesses to help them stabilize and prepare them once we defeat this COVID-19 coronavirus pandemic to lurch forward in a quick fashion. So without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. As the Mayor indicated, there was a pretty significant uptick with regards to people needing mortgage, rent, and utility assistance in the month of September. We previously allocated over $2 million to fund those types of needs. In July, the fund was advanced $34,000. In August, $145,000, and in September, it advanced $334,000. Obviously, the end of the federal assistance has had a very big negative impact on families. So to date, that fund has advanced $513,000, roughly 25% of the allocation that we budgeted for. And that's completing just 3 months of the year. We are actively doing intake and outreach with regards to small business assistance through Common Capital, and we cleared the $1.7 million review for the second phase of CDBG Cares. Just as a follow-up, I can't quite understand how anyone can question that there's a need for additional federal economic assistance to combat the fallout in so many ways with regards to the COVID virus, and the further delay of that assistance is only going to negatively impact businesses and families. Thank you, Mayor.
Thank you. Thank you, Director Sheehan. I appreciate my HR Labor Director, Bill Mahoney's here. He gave a status quo update, as did City Solicitor Ed Pakula, and Finance, which you've already heard too, with CAFO TJ Plant. So I believe we've given our update. With that, I'll open it up to questions or comments of cabinet heads or myself from, go ahead, Paul.
What's the continuing conversation with the neighbors administration for the state Department of Public Health about possible assistance from the state to help deal with the community spreading issues now? What specific help are you
I'm going to let Commissioner Helen Carlton Harris elaborate on that. Thank you.
Yes, on a call on Friday with Associate Commissioners Jenna Ferguson, what they offered was the ability to do personalized PSAs. They have a program where they use community ambassadors who are from the city as individuals who go into those hot spots that we identify. They offered materials in as many languages as we needed, and they offered the ability for us to work closely with the Division of Labor Standards. As you know, they are here in the city of Springfield, making sure our businesses are in compliance, and they are also have a team that will come to the city just to make sure that our restaurants, businesses are compliant. So that's the kind of assistance that they offered. We are considering two strategies to take them up on. One will be targeted PSAs, where we may ask the mayor or other trusted community individuals to do PSAs. We will also make sure that we're taking them up on the ability to have individuals in our community be those ambassadors in their neighborhoods who are paid stipends to be able to do outreach. Again, as I said to them, this is going to be something that we want to be mindful and careful of because of COVID-19. The last thing we want to do is send individuals into harm's way who potentially could contract the virus or spread the virus. So we're going to be very thoughtful about those, but those are the two strategies I see us employing.
You mentioned that you're utilizing robocall. What's it going to say?
The mayor and I will do a robocall very shortly. The robocall, I anticipate, will just remind individuals that we are in a pandemic, and those strategies that they need to use, or those tools or those interventions that they need to use in order to stop the spread. So I just anticipate we want to reach out to let the community know that we are thinking of them, encouraging them, and reminding them what's necessary.
And this is going to be city
We anticipate that the robocall will be citywide.
Thank you, Paul. Yeah, we've done that before to get information out, and as Helen pointed out, too, encouragement, and I know the residents appreciate that, too. Any other questions or comments? Yes? That I'm not aware of, no. No, I know there was some touch-up work. I know City Councilor Tracy Whitfield, Saturday, they wanted to do some touch-up work. So I have not been made aware of any type of, anything that was vandalized. And again, whether it is a monument, there's zero tolerance for that. And we look to correct it ASAP and then go after the culprits. But no, I believe Saturday was somewhat of a community event to do a little touch-up work that was headed by City Councilor Tracy Whitfield. I have not received any reports of anything being vandalized at this point in time. Any other questions or comments? Okay, hearing none, I want to again thank the media very, very much for getting this information out. I want to thank my cabinet heads, all the way down to rank and file, who have been tested and true through a number of natural and man-made disasters. I want to thank you, each and every one of you, the residents and the business community, for your continued patience, understanding, and collaboration. We need you to do it more than ever now. And to the young people, you are not invincible. And the decisions we're making now are not based on politics politically. They're based on public health, science, and medicine. So don't think any of you are invincible. Don't think that you're trying to make a statement. At times we get into this sense of lawlessness. You need to wear the masks. You need to wash your hands. You need to socially or physically distance 6 feet or more if you can. If you don't feel good, please stay home. Get those flu shots. That's going to help you as we're going through flu season. But it has been identified by Dr. Hessler and Public Health Commissioner Helen Carlton Harris. The numbers have shifted, and it's going to a much, much younger age. And that might show a carefree attitude that, hey, I'm untouchable. It's not going to happen to me. Well, it is happening to you now. So you did it before. We were a green zone. I know we can do it again to get out of this red, to move into yellow, and to move back to green, and eventually defeat this COVID-19 coronavirus. But I please ask you, I'm pleading to you, we cannot let our guard down, as you can see with the uptick in the numbers here. So please adhere to the advice we've given to you, that you hear through the media, and what Helen and I will be getting out very, very shortly. With that, I wish you good health, and go out and have a great day. God bless.